This episode of the Social Workers Rise podcast is partially brought to you by the 11th Annual Addictions Conference, Inclusive Recovery, Addressing Diversity and Co-Occurring Disorders. Check out the link in the show notes for more information. Hey, Lana, welcome to the Social Workers Rise podcast. How are you doing?
I'm good. Thanks for having me. How are you doing?
I'm doing great. I'm really excited to talk to you because I really don't know anything about how to tell if a client is lying to me. And so I'm just kind of interested to see what kind of tips you have for us today. But first, I want to know, who are you and what do you do?
Yeah, for sure. So, like you said, my name's Lana. I'm currently an associate professional clinical counselor and I work at a private practice. I'm a military spouse, so we're stationed down here in Southern California where I practice. And I basically provide mental health counseling for all populations. But my niche is definitely addressing like crisis and trauma, PTSD, depression, anxiety for military and first responders and their families.
Awesome. Awesome. Glad to have you. So, where did you learn this skill about how to tell when people are lying?
Right. Yeah. So I've held like various positions. One like at a at-risk youth center, and then also I was a police officer in my past. So I've dealt with quite a few people lying to me, probably more than I even know. But even with that, holding those positions, I think like on average, people typically only know or can like accurately detect like 50% of like lies that they get told. Majority of that success is basically like the proficiency of the person lying. um, but with that said, we can train ourselves to be like basically more attuned to like social cues that are associated with lying. So all of this information is basically things that I have experienced and then actually was taught in like the police academy, what I practiced as a police officer, and then like at the at-risk youth center. And then all of this I basically just implemented and tweaked into my daily life as a counselor.
Okay, great. So, this conversation came up with you and I because we were talking about seeing clients in therapy, in the therapy setting, and how we sometimes we feel like we're not getting the whole truth from clients. So when I guess my question is like, when can this be helpful, and why might people be lying to us even if we're in the therapy setting or if we're social workers? And like, what would be the reason behind it? Because I feel like when we just say, oh, they're lying, it just sounds kind of manipulative,
Right.
which I guess it is, but maybe it's not conscious. I don't know. I hope that question makes sense.
Yeah, for sure. So when I think about lying with like clients, at least in like the therapy setting, one of my most favorited supervisors that I've had so far once told me to always ask myself, what's the function of the behavior? So every time I get like this gut feeling or something's going on with this client that I'm just like, why is this happening? What are they doing? But I'm thinking of it more as like a clinical sense. It's just what's the function of the behavior. And so when it comes to lying in session, I think of protection, self-preservation. So like a lot of these tells that are associated with lying are typically anxiety responses. So this could be because of low self-esteem, avoiding, perceived punishment, to not get hurt, to maintain privacy. It's a defense mechanism to gain control sometimes. Maybe there's like underlying, like more severe mental health disorders. So I think when we see clients lying to us in person, it's typically because of like some sort of like protective mechanism.
Yeah, that makes sense. I feel like the most common lie that I get is people say, oh, I'm fine.
Oh,
They don't
right.
like,
Yeah.
okay, you're obviously not fine because you just told me how angry you were and upset.
Right.
It's not fine. So I wonder too, there's that, I don't know if you call it a white lie, but like you said, I could see how it is a protective factor. Like, I'm just not ready to talk about it right now. Could be another reason I would imagine that people would lie too.
Right, for sure. Definitely that like, okay, I'm gonna deflect. I'm gonna avoid all of this right now.
Right,
hmm
right, exactly. So, what are some cues that we need to be looking for when working with clients? And this is, I guess specifically within the therapeutic setting or direct practice or one-on-one, anytime that we're just interacting one-on-one with a client.
Yeah, for sure. So I have basically like three cues or three like tells of lying or deception. But first, I always like want to think we want to get a baseline of the person's like verbal and nonverbal communication. So like their speech and body gestures and just like what their personality is basically like. Because if we don't have that baseline, then we can be like assessing very wrong. So once we have that baseline, we can then assess like deviations. And to get that baseline, we can ask simple questions, especially ones that we already know the answers to, because then we can get like, okay, do they move their hands a lot when they talk? Or, what's their tone like? Is it going up and down? Like, are they pretty monotone? Like things like that. And then I'll go backwards kind of from like least important to like most important tells of lying. So I guess the biggest one, not in an interrogation setting, but more in a clinical like therapist setting, is anxiety responses. So like excessive fidgeting, sweating, like evasive eye contact. And then one that I get a lot is like finger pointing, literally or figuratively. So taking the focus off of them, they could like literally be pointing around because they want to like get that off of them and be like, well, you would do the same thing in this situation, or what about you, or what does your family look like? And so when they're trying to get that focus off of them, a lot of the times that suggests that they're trying to avoid the truth or avoid telling them about or telling us about themselves.
Okay. With that said, I can
yeah,
see how having the baseline behavior is helpful because some people are just anxious or some people just fidget a lot. So if you would need to know how they quote whatever normally act,
right.
and in comparison to when they might be telling you a lie.
Yeah, exactly. And so that kind of goes in with the second one of like, we definitely need a baseline for this one, which would be a change in speech pattern. So, like a rise and fall in tone. And then definitely a huge indicator is like, if we do ask a question, if the client has a very long pause or like hesitation before answering, that's typically a really large indicator that somebody's not telling the truth. But again, with these, we also have to think of like a cultural context because, Americans speak differently, like with American English, than let's say a different language or in a different place that speaks English. So in with like American English, a lot of people who are lying tend to go up in octaves, and it's like, oh yeah. So that's when we can kind of tell that a lot of people are lying, is their voice rises. But some languages, their voice tone will like fall a lot, and they'll talk a lot deeper, and that indicates a lie. So just like we were saying, getting a baseline first can really help with telling the differences between this.
Right. Yeah, that makes sense. And the other thing that I'm thinking too is as far as speech pattern, that can be impacted if you're going back and forth, like, do I reveal this? Do I keep this a secret? Or if there is that language barrier, I imagine there could be thoughts of how do I translate this into the language? So
Right.
the pause again with that baseline, knowing how they normally communicate and that baseline as far as the speech pattern. I'm wondering with speech pattern, or I guess with any of these, is there a difference between male and female? People identify as male and female.
We're going to hit pause on this conversation real quick because the next time that you need continuing education units, I highly recommend the Therapist Development Center. TDC has helped more than 100,000 social workers pass their licensing exams, including myself. I love that TDC CE courses are engaging and relevant. Amanda and her experts give us clear and practical skills that we can immediately apply to our work. Some of my favorites are their Edge of Life Suicide Prevention course, where Amanda shares her personal experiences, and their They Did What? Law and Ethics course that looks at real cases where therapists faced formal disciplinary actions. We are legally required to take continuing education to increase our competence, and most other courses out there don't actually teach the material in a way that we can learn it, but TDC does. Check out the links in the show notes.
There can be, for sure. And like women tend to do the higher octaves for sure, but I think men also do. But again, that one a lot has to do with the baseline, like seeing what their personality actually is like, and seeing what deviations they use, because most people have a tell. Like people who are lying typically will do the same thing every time they lie. And they just don't know it. It might be like subconscious, but usually everybody has their very specific little tell. So once you get to know the person, you'll be able to really, once you get that clinical gut feeling, you can tell. And so differences like gender wise, that's typically going to be more like, okay, do I know the person? And then like, what is their tone? And like, when is that tone associated with a certain type of truth or something?
Okay. Okay, cool. So first we have get the baseline.
Mhm.
Second is anxiety responses.
Mhm.
Third, I guess, would be this change in speech pattern. And what would be the fourth thing to kind of look out for?
So yes, this is the biggest, best indicator that someone's lying. This I saw so much as my time as a police officer. And this one, like research backs up. This is like, if we use anything, this is going to be the one to detect lies or deception. And that's intentional vagueness. So if somebody is very vague, shares very minimal details, and then they're inconsistent with that story, they're typically lying. And I know that kind of sounds like this duh answer, but people who are truth tellers can speak in great detail and they can do it consistently because they actually experienced it. But when we don't, and like maybe we are saying this elaborate story, but if we tell it multiple times and we're lying, there's going to be a lot of discrepancies in that. And I see that probably the most, and I've seen that in my police life, even in therapy. That's the biggest indicator that someone's lying to me.
Okay. So being overly vague. All right, awesome. So with all that said, we're going to get our baseline. We're going to be constantly assessing and just watching them for any kind of anxious response. We're going to be noticing any kind of changes to speech pattern, and if they're being overly vague with something. So if somebody hits these I don't know, check marks, I guess, if we check all the boxes here, I guess that's my next question. Do they have to check all the boxes, or can they have one of these?
Yeah, they can have one, and that's like really up to our like clinical judgment. Again, like the last one, the intentional vagueness, that one is going to be the biggest indicator. But I mean, even if we get that gut feeling that like, okay, if they hit one of these, then it's like it might kind of like ring a bell and be like, oh, I want to look more into that. They don't have to be doing all of them. Like I said, like some people who lie are very good at lying, so they're not going to have a lot of anxiety responses. They're going to be really even keel. And then maybe they won't have any changes in speech pattern either, but maybe they do have a lot of vagueness, or vice versa. So
okay, what would you recommend as I don't know if gentle is necessary to the therapeutic setting, but I guess that's just my style. Like, what would be a gentle way of calling a client out if you do see that they're showing signs that they might be trying to preserve or not tell us the entire truth?
Right. So like confrontation. And I feel yes. And like I love therapeutic confrontation. So I love this like question and this idea. And it's like in my specific position, similar to being like a rookie cop, a positive aspect of being this like baby counselor is that like I'm fresh out of my master's program, so I'm like filled to the brim with like heavy training, and so for like basically everything comes down in my head to like basic counseling skills. So like rapport building, like we're not here to interrogate, we're here to work through whatever the client is feeling. And why they need to protect themselves in session. So it, in one sense, in my past life as a cop, it looked a very different way if somebody was lying to me versus therapeutically. I may want to know why somebody's lying for the purpose of like, what's lying underneath that. So again, yeah, basic counseling skills. So like reflecting, just being a mirror, reflecting back, maybe rephrasing it or summarizing what they're saying so that like if they are lying and you tell them what they just said, they might be like, oh, yeah, that did sound like a lie. Or like, oh, maybe they do know that I'm lying and like, oh, geez, why am I doing that? Immediacy, basically what's happening in session between the client and counselor. Silence with the right client can be really powerful with lying, just sitting there and looking and like nodding the head or things like that. And then lastly, just using questions with genuineness, empathy, and like curiosity. Again, we're not here to interrogate them. So we may never know the truth, but that's not really the point. We're here to address that, what's underneath of that truth or lie in a safe space without any judgment.
Right. Yeah. I love all of those tips. And as you were talking, I was thinking about my own work. And, now that you just pointed out, when clients have not told me the whole truth, it is a lot of self-preservation because they're trying to protect themselves, their family in some way. And I noticed that what I would do a lot is just coming from a place of curiosity and asking a lot of questions and even pointing out that something might not be off or something might be off, right?
Mhm.
So you're saying one thing, but your actions have shown me something else. So I'll say it, and I'm just trying to understand. Help me to understand where the disconnect is here. Have I missed something? Or do I understand this correctly? So really kind of asking those clarifying questions and using that reflection that you mentioned back is usually what I try to do when working with clients. And it seems they'll either go further down and I'll see, okay, this is not going anywhere, or they'll kind of backtrack and be like, okay, well, this is the whole story.
Right. Yeah. And then you'll see what's down there for sure. No, yeah, that's exactly, I've done the same thing of just like asking like, hey, like you said this, but I'm seeing this. Like, can you help? Can you explain that a little bit to me? Or can you walk me through that? And just like asking out of just like pure curiosity, I think helps a lot.
Right, right. Well, thank you so much, Lana, for sharing your knowledge with us.
Yeah.
Anything else that we need to cover that you feel like we missed?
I don't think so. Yeah, no, this was super fun. I'm glad I can, use my past life and my current life and mesh them together all in one. So yeah, this was great.
Awesome. Thank you so much.
Thanks.
Thank you for listening to the Social Workers Rise podcast. I want to give one final shout out to one of our sponsors, Social Work Wealth Con 2024. Thank you so much for your support of this podcast. Check out this conference in October with the link in the show notes.